How do you treat a herniated disc in your lower back at L4, L5, or L5-S1? That's a loaded question, and it's one that you shouldn't try to solve based solely on a YouTube video. However, I will share some various treatment options based on your signs and symptoms to help get you pointed in the right direction. Now, why are herniated discs at L4, L5, and L5-S1 so common? Well, there are two main reasons for that. Number one is that they're the lowest discs in the spine, and so they have the most weight bearing on top of them. Furthermore, they're at a transition point where the spine changes from being concave to convex, and that creates a stress point. Now, the symptoms of L4, L5, or L5-S1 herniated discs can vary widely. And that's why there's no one straightforward treatment option that works for everyone. Some possible symptoms are you could have no symptoms. You could have a herniated disc and be perfectly fine. And in fact, 30 to 40% of people without any pain at all do have a herniation or protrusion somewhere in their spine. So just because you have a herniated disc doesn't necessarily mean that you'll have pain. Furthermore, you might happen to have pain and have an MRI where they notice a herniated disc that may have been there for a long time. So even if you do have a herniated disc and have back pain, you also want to make sure that the herniated disc is the cause of the back pain and not just some random coincidence. Now, another symptom could be that you have localized lower back pain. This may be back pain when you do something that involves compression of your spine, like lifting something heavy, or if you sneeze or cough or bear down to go to the bathroom and that increases your lower back pain, that may be a sign of a herniated disc as well. Furthermore, you can have radiating symptoms that go down the leg. And based on where the herniation is, you may have a different pattern of radiation. The L4 nerve root comes down the leg like this and wraps around the inner side of the leg down there. The L5 nerve root runs down the outside of the hip and then down the front outside of the leg and into the top of the foot. And then the S1 nerve root runs down the back of the leg, back outside of the leg, and the outside of the foot. So based on where you feel your pattern of symptoms, that may help you determine if or which nerve root you're pinching. Now, another possible symptom is that you could have changes in your bowel or bladder functions. That's referred to as cauda equina, where either you can't go or you can't hold it, you're having accidents, and that is a more serious concern, something that may require surgery sooner rather than later. Furthermore, if you have progressive weakness in your leg, where you notice your leg feels kind of weak and it's getting worse over time rather than better, that's another time when you may possibly need surgery. Outside of those two circumstances, most herniated disc problems can be healed conservatively given enough time. And it may take 1 to 2 years for a herniated disc to heal completely on your MRI. That means for it to be there and then not be there anymore. However, you may not necessarily have pain during that whole period of time. Because remember, you can have a herniated disc on your MRI and also not have pain. So the key is keeping the space open around your nerve long enough that you can recover without causing permanent nerve damage, which is why the progressive muscle weakness is something to look out for. Now, provided you're not having changes in your bowel or bladder functions or progressive muscle weakness, conservative treatment is the first line treatment for herniated discs in the lower back. And that includes things like physical therapy. Now, physical therapy can be very diverse as well. So what exactly is physical therapy for a herniated disc at L4, L5, or L5-S1? Well, that also depends somewhat on your pattern of symptoms, even more so than what's on your MRI. And to tell the truth, as a physical therapist, your MRI isn't really all that relevant to the treatment other than if there were something severely dangerous that's potentially causing changes in your bowel or bladder functions. Now, if you just have localized lower back pain, then the most common thing that you'll need to do is stabilize around the spine, because the discs are the main stabilizers between the vertebrae in your spine. And provided you're not having symptoms that go down the leg where you're pinching on a nerve root, it seems that you've got enough space where the nerves come out in your lower back. You just have to use the muscles to make up for the stability that the disc is lacking. Furthermore, discs have a very poor blood supply. And so you do want to try to stay active and be as active as you can rather than bed rest. Because when you move, when you walk, when you do other types of aerobic activity, that diffuses nutrients from the vertebrae above and below down into the disc to help out with the healing process. Now, if you are having symptoms that go down your leg, then you want to look at what aggravates the symptoms in the leg or what makes the symptoms better. For example, if you have more pain or weakness in your leg when you're standing or walking, that probably means you're more sensitive to positions of spinal extension or backward bending like this. And so in that case, the way to take pressure off of the nerve roots is doing the opposite. So forward bending exercises, for example, bending down from a seated position, sometimes even bending straight down and hanging all the way down from a standing position may even feel good, even though that's something that people say you typically shouldn't do for back pain. But if you have more of an extension related problem, then flexion or forward bending, even sometimes from a standing position, is okay. You just don't want to get stuck in this mid-range where gravity is pulling you down and causing sliding of one disc on the other. Now, another option would be stretching back like child's pose, like this. So really any option that brings your chest closer to your knees or your knees closer to your chest, like a double knees to chest or a single knee to chest exercise, those are all good if you have symptoms going down your leg more when you're standing or when you're walking. But what if you have the opposite problem? What if you have pain that's worse when you're in bent over positions or when you take long trips in the car or when you're sitting in a chair for a long time? What if your symptoms are worse in that case? Well, then you want to do just the opposite. You want to do extension exercises. And walking is great for that because when you do walk, your spine is in a relatively more extended posture. But additionally, doing backward bending exercises like this, or press-up exercises or cobras like this, where you go into a back arch, those can also be helpful if you do have radiating pain down your leg when you're sitting or when you're in relatively flexed or bent over positions. Now, if you do those exercises, the goal of those is to centralize the pain out of the leg and back into the spine. And sometimes that means your lower back pain may get a little bit worse as the pain centralizes from the leg back into the back. But if the leg symptoms are getting better, that's a key that you're probably on the right track. Now, after that, after you've gotten the symptoms to centralize back into the lower back, then it becomes more like you're treating a localized lower back problem again. And remember that the discs are the main stabilizers of the spine. So you want to make sure that one vertebrae isn't slipping on another one so that you don't re-aggravate the nerve roots and cause the symptoms to go back down your leg. And to do that, you want to do spinal stabilization exercises. And you can learn some spinal stabilization exercises in these two videos over here. But before you go check those out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.